Okay. Hello, I'm Dr. Tracy McClellan with the Medical Institute of South Georgia, and we are going to talk about Chapter 2 in your Nurse Aide training book, which covers Foundations of Resident Care. The book we are using looks just like this. Okay, let's get started. Hopefully you have successfully completed everything in Chapter 1, and you are ready to begin with Chapter 2. So let's dive right in. Foundations of Resident Care. This chapter is all about keeping residents safe, preventing infection, communicating effectively, and providing care with skill and confidence. These are the habits that make you a trusted nurse aide in the healthcare arena. So section 1 of, you should be able to follow along in your book, is going to cover infection control, and we want to look at that starting off. As I'm going through, I want you to take the time to scan through your book. Maybe you had a chance to read this, or maybe you have not. As you're scanning through, as I cover the sections, just kind of highlight things that are mentioned that you really need to pay attention to. So infection prevention is at the heart of everything you do, especially what we do in healthcare. So every day you'll come into contact with microorganisms. Some of the organisms are harmless and others are very, very dangerous. Your job is to break the chain of infection. That chain includes 6 links. Okay, that's going to be important. The infectious agent, reservoir, portal of exit, method of transmission, portal of entry, and susceptible host. You break that chain by washing your hands properly, wearing gloves when needed, and cleaning surfaces and using proper disposal for contaminated materials. Remember, hand hygiene is the most important step in preventing the spread of disease. You'll see test questions everywhere regarding that. So wash before and after every resident contact, even if you wear gloves, make sure you wash your hands. Infection control is very, very key and vital in healthcare. Okay? All right, section 3, standard precautions and PPE. Standard precautions and PPE. So standard precautions mean treating every person, every fluid, and every object as if it could be infectious or contagious, okay? Just because something looks clean or a person looks clean and you're thinking it's okay to handle their blood, everyone is potentially infectious. You treat all of that as if they are contagious. So how do we prevent the spread of infection? Use gloves, gowns, masks, and when needed, use eye protection whenever there's a chance of exposure. That's important to remember those things. Always remove your PPE, which stands for personal protective equipment, before leaving the resident's room, and make sure that's right, that you wash your hands immediately afterwards. And never reuse disposable equipment. One resident, one use, one disposal. Those are things to keep in mind. Okay, and then for section 3, safety and body mechanics. As I mentioned in chapter 1, anything in that chapter that has bold print or is the heading, you need to make sure you highlight that and that you read it and read it more than once. So section 3, safety and body mechanics. Safety is more than avoiding accidents. It's anticipating risk. Always check bed breaks, identify residents correctly, and keep walkways clear. When you lift or move someone, use proper body mechanics. Keep your back straight as much as possible, bend at your knees, hold objects close to your body, and avoid twisting. That's going to help prevent incidents occurring with you. We need you. You're the healthcare provider. Protecting your own health means you'll be strong enough to protect your residents. The last thing we need is you having to call in because you can't come to work, you're injured. So always remember how to protect yourself. Now, section 4, communication and interpersonal skills. Communication and interpersonal skills. Good communication skills build trust. Always introduce yourself by name and title. Hi, my name is Tracy. I'm going to be your nurse aide today. Okay. Speak clearly, use respectful language, and listen carefully. Nonverbal communication matters just as much. Your facial expressions, your tone, your body language tells the residents how you feel about them. So be careful with the frowning and the acting like you smell something, and maybe you do smell something. Nope, it is not okay to act like it. You can respond to it, maybe by cleaning the patient up or discovering if there is an issue that needs to be addressed, but you don't make residents feel bad because you've got the frown face because you smell something. More than likely, you probably are going to smell something. If a resident has hearing or vision loss, you want to adjust your approach. Speak face to face, reduce background noise, or offer written notes. And remember, confidentiality applies to your words and your tone. Never discuss resident information where others might overhear you. Okay? All right, Section 5. Section 5 covers observation, reporting, and documentation. As a nurse aide, you are the eyes and ears of the healthcare team. You spend more time with residents than the physician, than the nurses, okay? And so your role is vital in determining what's happening with a resident. You'll spend more time with residents than anyone else, which means you're the first to notice changes. You want to be sure and observe carefully, notice appetite changes, mood changes, skin condition, or mobility issues. Maybe she was able to get out of bed. The resident was able to get out of bed yesterday, and today the resident's mood is different. They don't want to get out of bed. They don't want you to turn the lights on. Something has changed, and that needs to be reported. Report anything unusual to the nurse immediately, and then document accurately. In healthcare, if you don't document it, it wasn't done, okay? Documentation must be factual. You can't document your opinions. Document only what you see, only what was said, okay? And you want to make sure you document in a timely manner and write it in ink. Never erase or falsify a record. Now, most documentation is done through digital insert. You're going to go to the computer and type in their vital signs, type in their bowel movements, and how much urine they put out. If it isn't written, as I said earlier, it didn't happen, so make sure you chart carefully. Section 6 in Chapter 2 goes over promoting resident safety and comfort. This is very important. Remember, most residents, this is in their later part of their life, and the things that would normally concern people that are out and working and going out to eat and doing different things, they have a whole different set of things that gives them comfort. And now we have to be concerned with what they are concerned with. So let's look at promoting resident safety and their comfort. Residents depend on you to maintain a safe environment for them. Keep the call light within reach. I cannot tell you how many times residents have fallen and they lay there because they can't reach their call light, or maybe they're in bed, but the call light fell on the floor and now they can't reach it. So always check that before you leave the residence room. You want to adjust the bed height when you're finished so that if they try to get out of bed, they don't have so far to step down. Encourage residents to use assistive devices correctly. Assistive devices are things that are used that will help them pick up items that we can normally bend over to get. They are no longer able to bend over. So those things are become very important to the resident. Never rush care. You cannot rush an elderly person. They move slow. Their thinking process is slower. And I know you may feel like, well, I've got 10 patients down the hall, but you're not going to be able to get in a hurry because they don't get in a hurry. You're going to have to be calm, reassuring, have a reassuring presence, and that can help prevent falls and prevent the resident from being fearful. Every act of care is also an act of respect. In closing for chapter 2, foundations of residence care, infection control, safety, and communication are not just skills. They're the foundation of excellent care. As you practice these techniques, think about how your small actions, such as hand washing, speaking kindly, reporting a concern, how that protects lives. Be sure to review your infection control steps tonight and challenge yourself to be the kind of nurse aide who sets the standards for safety and compassion. In chapter 3, we'll explore how to truly understand your residents as individuals and support their emotional and social well-being. And that's our overview for chapter 2. Keep in mind all of the bold print, things that you see, you need to highlight them, read through them several times. Be sure you know all of the definitions.